Hello everyone, I am Dr. Karan Shah. I am a dermatologist and I am practicing in Kalyan since last 8 years. So I hope everyone is safe and taking all the good precautions for your health and your near and dear ones. So today we will discuss on the few basic skin problems and the basic treatment regarding the same. So first is acne. Simple bachet it is called as pimples also. Pimples a condition it is very common, occurs in younger age, and nowadays it is occurring in old ages also, like in 30s and late 40s also. There are many reasons behind the pimples, like the most common is the hormonal imbalance, that there is a role of diet, there is a role of some propionobacterium acne. So there are n number of reasons behind it. The basic precautions you are supposed to take is you are not supposed to prick the lesions, otherwise it will lead to creation of new lesions and it may lead to scarring and pigmentation. So the best thing is you should visit a dermatologist as early as possible. Dermatologist will suggest you few creams depending on the severity and tablets and face wash. These are like the basic precautions, basic treatment for your acne. In some cases in which there is a pigmentation and scarring, the dermatologist may suggest you some chemical peel or some laser treatment for the better improvement of your face. So if you facing the same problem, so please visit a dermatologist. So this was regarding acne. Now the second disease we'll discuss is like fungal infection. The fungal infection is creating a great problem right nowadays, and many people are affecting with the fungal infection. It is in normal language it is called as Naita, Gachkarna, Dinai. There are a number of local names. The main problem is it starts with the itching, groin, underarms, like the folded area. Wherever you get excessive sweating or tight skin, tight clothes or skin folds, you get the you develop fungal infection. So the main symptom of fungal infection is like itching. You get severe itching and gradually that patches grows on increasing in circle. The most important thing is you are not supposed to apply any over-the-counter medicines. There are n number of over-the-counter medicine creams available which you are not supposed to apply, because those cream will create more problem. It will give you temporary relief, but in the long term it will create more problems. So the first and most important thing, if you are facing the fungal infection problem, please go and meet a qualified dermatologist. That is most important thing. Other thing is it is found that there are not just a single member, there are 3 to 4 family members are affected at the same time. So those who are affected all should get treatment as soon as possible. You are not supposed to share your clothes, your towel. You have to keep your basic hygiene proper. So these are like basic precaution. Once you visit a dermatologist, he'll suggest you some medicines and some creams. So other important thing is you are not supposed to discontinue the course. You have to complete the course as your dermatologist advises. Generally, in today's scenario, the treatment of fungal infection has to be taken for minimum 6 weeks. So not 6 weeks exactly, 6 to 8 weeks. So like 2 months. That is the most important thing. If you discontinue the treatment in between, it may lead to recurrence. It may lead to more fungal infection, and you will spread it to your family members also. So please take treatment from a dermatologist and complete your course. Okay. So this was regarding fungal infection. Third thing we'll discuss is like vitiligo. Vitiligo is commonly called as safed dag or dag pandra chatta and all. In Marathi it is called as code row. In society there is a very much fear regarding this white patch or vitiligo, but it's a disease of a skin pigment in which a particular area's skin pigment has lost. It is not like that if you once develop your patch, your whole body will develop the same lesion and all. It's a myth. So as soon as you develop this kind of thing, meet a dermatologist and take a proper treatment. It is not contagious. It is not at all contagious. Okay. So once you visit your dermatologist, depending upon the area involved, depending on the extent, depending on the stability, the dermatologist will suggest you n number of treatments. The basic treatment starts with the like phototherapy, creams and tablets. Nowadays there are latest treatment available. If your vitiligo is stable, we can definitely do a surgical procedures to give you a better outcome. So vitiligo is definitely treatable. It is 100% treatable if you start treatment early. That is the most important point. So whenever you are in doubt, meet a dermatologist and take a proper treatment. Okay. So the next thing now we'll discuss is psoriasis. Psoriasis also is very common disease. It is very chronic disease. In psoriasis, patients generally develop itchy red colored lesions which has scalings like powdery lesions on the extensors, elbows, knees, lower back, and patient develop lesions on the scalp also. Excessive dandruff, we called it. Psoriasis also is like, it's a chronic disease. There is no permanent cure, but it is 100% controllable. So whatever problem you are facing, it will remain under control 100% with minimal medicines and creams. Psoriasis disease tend to increase with your winter, like climate. Other thing is stress. It can increase your psoriasis lesions. There are few illness, there are associated obesity and other morbidities. It also leads to aggravation of psoriasis symptoms. So psoriasis is also a treatable condition. You have to meet a dermatologist, take a proper treatment. For psoriasis also there are n number of treatments available. Generally it starts with the creams and basic medicines. If it is not controllable, your dermatologist will suggest you some investigation, and he might suggest you some big powerful medicines, some systemic medicines. But with the help of this, it definitely will, you will definitely get the relief. So meeting a dermatologist is important for psoriasis also. Okay. So thank you everyone.